Hi everyone, welcome to another episode of Psych Talk. Today I will talk about the difference between sociopathy and psychopathy. So, what is the difference? What is the main difference? In simple words, sociopaths are made and psychopaths are born. So, what we see is that psychopaths are often thought to be born with a smaller or underactive amygdala, which is basically a critical part of the brain responsible for processing emotions like fear, empathy, and guilt. And thanks to neuroscience, basically we can see that psychopaths have structural and functional differences in their amygdala compared to neurotypical individuals. Whereas sociopaths, they might have had a different type of childhood, so they might have grown up in a very like different kind of hard of environment. So they might have had abusive parents. They might have grown up in a neighborhood that was dangerous. Maybe they had alcoholic parents or drug addicts parents, and they were just surrounded by people who were misbehaving and engaging in a lot of risky behaviors or breaking the laws constantly. And so they have like a lot of trauma. And that is why we say that sociopaths are made, but psychopaths are born. So sociopathy tends to be shaped more by environmental factors, such as childhood trauma or abuse, rather than just innate brain differences. And so, unlike psychopaths, sociopaths may not have significantly smaller amygdala. However, their amygdala often shows lower activity when processing emotions like fear and empathy, which may explain their difficulty fully understanding or responding to others' emotions. But one thing that I want to mention is that basically both terms describe individuals with antisocial personality disorder, which is a mental health condition that is recognized in the DSM-5. But basically, psychopath and sociopath are not official clinical diagnoses. So they're not in the DSM-5. But antisocial personality disorder, it is in the DSM-5. And they're basically, sociopath and psychopath are more like subtypes or colloquial terms that are commonly used in forensic psychology to describe specific behaviors or traits. And so maybe also that is why it can be very confusing to people because, well, it is not present. They're not present in the DSM-5. So let's break down the key differences between psychopaths and sociopaths. When it comes to emotions, psychopaths lack of empathy. They're very cold and calculated. Sociopaths, they have limited empathy and they're extremely impulsive and reactive. In relationships, psychopaths, they are superficial and they use people for gain. So they see people as objects. Whereas sociopaths, they struggle to form attachments. When it comes to behavior, psychopaths, they are manipulative, charming, controlled, whereas sociopaths, they are hot-headed, prone to outbursts. When it comes to conscience, psychopaths feels no guilt or remorse. Sociopaths, they may feel some guilt, but not enough to stop harmful actions. When it comes to criminality, psychopaths plan crimes meticulously, whereas sociopaths, their crimes are more often very impulsive. And when it comes to career and functioning, psychopaths, they can blend into society and they can hold jobs, whereas sociopaths, they struggle with stability in life and it's hard for them to maintain jobs. For example, for a sociopath, an example of a sociopath could be someone involved in petty theft or bar fights, and they're more openly aggressive and emotionally reactive, making their behaviors harder to hide. Whereas an example of a psychopath could be someone who works as a corporate executive who steals millions of dollars without feeling any remorse. And they may be charming, intelligent, and appear perfectly normal on the surface. So, forensic psychologists often use these labels to describe patterns of criminal behavior or personality traits that help in risk assessment and understanding a person's motivations. So, these terms are very helpful when working in settings like criminal profiling, so understanding traits of offenders in unsolved cases, also in court evaluations, so determining whether someone poses a future threat, and also risk assessments, so predicting the likelihood of reoffending. And while these are not official diagnoses, terms like psychopath or sociopath, they provide a shorthand to describe specific behavioral patterns that are relevant in legal and criminal contexts. And the DSM-5 uses antisocial personality disorder as the official diagnosis because it kind of encompasses a wide range of behaviors and traits, including those seen in both psychopaths and sociopaths. And the DSM avoids narrowing it to like specific subtypes. And so both psychopaths and sociopaths are considered to fall within the antisocial personality disorder spectrum, quote unquote, but they emphasize different traits. And what antisocial personality disorder involves, it will be like a persistent disregard for the rights of others, deceitfulness and manipulation, impulsivity and irritability, and lack of remorse for harmful actions. And so, as a summary, both psychopaths and sociopaths fall under the umbrella of antisocial personality disorder, but a sociopath is more of a person that kind of exhibit this type of behaviors, this antisocial behavior, due to childhood trauma. Whereas for a psychopath, it seems that there is a stronger genetic component. They seem to be born that way. Obviously, for both is always both nature and nurture. But obviously, with psychopathy, it seems like they have a different, a smaller amygdala. Whereas sociopaths, they seem to have had more childhood trauma. And this is the end of the episode. I hope you enjoyed it, and I hope that the difference between psychopath and sociopath was very clear.